Hello, everyone. Thank you for joining us for our monthly interview. I'm very proud to introduce a longtime colleague and friend, Jerome, otherwise Jerry Paulson, Dr. Paulson. We actually met the summer of 2000, working at the Children's Environmental Health Network. And Jerry was a science advisor at the time, doing a fellowship, and I was just getting my feet wet out of grad school. And it's been wonderful ever since. Jerry, I know you attended our wedding, you and Gwen, and it's just been a wonderful mentoring, but as well as just enjoying working together to protect children and to uplift this important field that we care so much about. So welcome and thank you for joining us.
Well, thanks. I've certainly enjoyed our collaborations over the years. I think we've achieved some good things working together, and it's always been a joy to work with you.
Well, thank you. Well, it's an honor to have you here with us today. So could you share, for those that may know you and maybe they'll learn something new, and maybe those that don't, what did your journey look like? I know you're a medical doctor, an MD, and I've heard some of your story, but if you could share your journey about how you kind of decided to go into medicine, and then even more specifically, how you then got into this field of children's environmental health, that would be wonderful.
So in terms of deciding to go into medicine, I was not one of those people who, knew from the time I was 5 that I was going to be a doctor. I thought I was going to be a chemist. And, part of the story of the change has stayed with me throughout my entire career and really has influenced everything I do. So through a friend of my parents, I was looking for a job in a laboratory, and the University of Maryland School of Medicine in Baltimore, where I grew up, somebody sent me to meet with a pediatrician, and he said, I don't have a job for you, but come back next summer. And I don't know whether he thought I would turn up or not, but I did. And so he hired me, and he was creating a neighborhood health center. So this was the mid 1960s. It was the Office of Economic Opportunity, as we tried to, in that iteration, make things better in some of the inner cities around the country, and the neighborhood around the University of Maryland is the same neighborhood that in part blew up with the Freddie Gray disaster a couple of years ago. So things turn over and change, but unfortunately don't change enough. So I got to see this plan the first summer, the beginning of the implementation in the second summer. I went back for 4 summers. And then by the third summer, I was already starting to see, changes, cutting here, cutting there. And I think that issue of trying to build something and getting it off the ground in a really wonderful kind of way. I was in the lab, so I wasn't intimately involved, but I was an observer, and they had a community advisory board, and on and on and on. And to see that change, I think, has stayed with me. So over those several summers, I kind of realized that, being the lonely chemist with my test tubes and whatever really wasn't going to do it. So I went to medical school. I had no concept of advocacy. That certainly wasn't in the lexicon of medical education, but I did want to work at the interface between medicine and government. And I didn't, that was a sort of an ill-formed idea at the time. I was accepted into law school at the same time I was accepted into medical school. So I was supposed to get both degrees. Some family stuff intervened and I never did go to law school. But I thought that, you know, by having a legal degree, I could somehow or another figure out how to work at the interface of the government and medicine. So I did my pediatric residency in Baltimore at Hopkins and at Sinai Hospital. This is the mid-70s now. And lead poisoning was just part of our everyday. We had kids in the outpatient department. We had kids admitted all the time. What is now the Kennedy Krieger Institute was then the Kennedy Institute. And they had a huge lead clinic there. And so it was just part of our education. We didn't sort of think of it as environmental health for sure. And then when I went to my first faculty position, Cleveland, Ohio, Case Western Reserve, Rainbow Babies and Children's Hospital, big city, a lot of old housing, a lot of kids with lead poisoning. And I sort of was the one person in the primary care division who kind of latched onto those kids and learned a lot about lead poisoning. But again, it was lead poisoning as a clinical health problem. Did a little bit of work with the public health department there, but again, no thoughts particularly of advocacy, no thoughts of environmental health. What did happen when I got to Cleveland, I had done a little bit of research at Sinai on the use of car seats. They were brand new at the time. Parents didn't know anything about them. Physicians didn't know anything about them. And when I got to Cleveland, the president of the Ohio chapter of the American Academy of Pediatrics came to me and said, well, you know about car seats, and the Ohio chapter of the American Academy of Pediatrics would like to get a law requiring parents to put kids in car seats in the state of Ohio, and asked me if I would lead that effort. Yeah, sure, why not? So, you know, I think this speaks to taking the opportunities that you're given, being open to learning, learning a huge variety of things as I've had to do with my work in environmental health over the years. So it took 2 legislative sessions, but I did build a coalition, parents, police officers, injury prevention specialists, other physicians throughout the state of Ohio. We became the 5th state in the union to have a mandatory seat restraint law. So that's the beginning of the advocacy track. And then I went on to become a Robert Wood Johnson Health Policy Fellow, coming to Washington, D.C. in 1985, ostensibly for 1 year. I'm still here, so what can you say? Has to do something with meeting a wonderful woman and needing to stay where she was. But so that's the beginning of the advocacy track. And then when I got to George Washington University in 1990 to teach primary care pediatrics again, I was again in a situation, city, a lot of old housing, a lot of kids with lead poisoning, nobody particularly interested in the idea over in the GW campus. There certainly were people at Children's National who were interested in the idea. But I sort of picked that up and got involved with the Lead Poisoning Advisory Committee in the District of Columbia. And then around that time, there was this person in California, a couple of people in California Joy Carlson, Dick Jackson, who were starting to talk about environmental health and children's environmental health and other toxins beyond lead. And so I did some of the trainer programs and became then a trainer, and taught a bunch of people about children's environmental health. And so that's then the second track, the advocacy track and the children's environmental health track. I was on the American Academy of Pediatrics. At that time, they called it, what did they call it? There was a council on the Committee on Government Affairs, and it was both state government affairs and federal government affairs back at that point in time. So I latched on to, between my experience in Ohio and then after my RWJ fellowship, serving on the Academy committee, I realized that by latching on to an organization, I could use them, and I really mean that, to use an organization to multiply my effect. I can't do all of this alone. I need to work every day to make the world a better place. That's the driving imperative. And I can do a better job when I'm part of something than I can do on my own. So it's whether it's part of the academy, it's whether it's part of, Children's Environmental Health Network when you and I work together, other groups and organizations that I've been a part of, over my career. It's using those organizations in service of making the world a better place, to have a multiplier effect.
Excellent. I couldn't say it any better. And I think we both know about what it is to think we're moving to the Washington, D.C. area for a limited amount of time and then meeting what ended up being our partners in life, which is awesome. And I know a lot of us in the child health arena definitely still lean on the seat, car seat and seatbelts and other key public health measures as trying to show those who may try to buck the system and wonder if there's any evidence to taking action and what that really has on return of not only quality of life, but life in general and having it. So it's just awesome to hear I didn't know some of those connections to the car seat, Jerry, along with some other wonderful knowledge you just shared. So thank you for that. I'm sure that's going to be extremely useful for our listeners. So switching now to another, I think, very vital leadership role you've had with the Pediatric Environmental Health Specialty Units. Also, when we were working together, you were and have been for a long time an active part of the MidAtlantic Center for Children's Environmental Health, which again, these Pediatric Environmental Health Specialty Units are in every region of the country. The MidAtlantic Center is ours here in Region 3. Which I know you had an active leadership role in for many, many years. Could you speak more about, these units? And I know they're very important to you, and just sharing, about the incredible resources that they are for all over the country.
This, my work with the Mid-Atlantic Center is, again, part of that trajectory. So Joy Carlson, Dick Jackson, Susan West, and Susan Marmagus. So I learned stuff about children's environmental health, some toxicology, and things like that. And around 2000, ATSDR through the Association of Environmental and Occupational Clinics put out a call for proposals to create these pediatric environmental health specialty units, one unit in each of the 10 regions of the country, as you've alluded to. And so the Mid-Atlantic Center covers Pennsylvania, Delaware, Maryland, Virginia, West Virginia, and the District of Columbia. So John Balbus was a faculty member in the Department of Environmental and Occupational Health on the downtown campus at GW, and I knew John. And then Ben Gitterman and I were involved, another pediatrician here in DC, in several projects over the years, but the three of us submitted a proposal to create the MidAtlantic Center. We got that proposal. We got it off the ground. I ran the MidAtlantic Center until about 2015, and then helped, before that, had helped the American Academy of Pediatrics along with the toxicology folks get the management contract for the whole Peso Network throughout the US. And so I was the medical director for the Pesos in the eastern part of the US and worked to help support and grow that network. So unfortunately, the Pesos remain very small, like so many other things, underfunded, understaffed for, just think we've got Delaware, Virginia, West Virginia, Maryland, Pennsylvania, and the District of Columbia. And we did that with one part-time, eventually a full-time staff person, and then, these very, very 10% time or something like that support for docs or other people who might have been involved over the years to cover, that geographic area and try and respond to calls that ranged from lead poisoning to mold to, really totally off the wall, unusual chemical exposures that, there's absolutely no data in the literature about human health impact, much less about impact on children. I mean, as you know well, and say, because you've been involved in the fights around the legislation that's known as TSCA, Toxic Substances Control Act, here in the US and around the world, there really are not, even today, adequate measures to ensure the safety of chemicals that come on the market, with the exception of medications and, to a more limited extent, pesticides. And even with the Lautenberg amendments that we fought so valiantly to get passed, about 6 years ago or something like that, unfortunately, with the lack of interest of the previous administration and even the, fact that the Lautenberg amendments didn't make radical changes in the management scheme for TSCA, we still don't have a good system for managing chemicals. The Europeans have the beginnings of a better system, but they're building it out so slowly that we'll never get there. I mean, this process, if it continues to move at these glacial paces, we'll never get there. So, but the Pesos, continue to play a role. They're playing a huge role in this major problem in so many both rural and metropolitan parts of the country, with contamination of water supplies with perfluorinated chemicals. They do a tremendous amount of education, ranging from the general public, medical students, residents, physicians, and other health providers throughout the country. They devise sets of recommendations, some of which then go on to be adopted by the American Academy of Pediatrics or other organizations. They've been involved in a lot of the discussions around what do you do about school and air pollution when the world is burning down because you've got raging forest fires all over California, and is it safe to let the kids go to school? Is it safe to let the kids out on the playground for exercise? They need exercise, but it's probably not good breathing that air. And again, it's trying to function in a space where there's extremely limited data. You can extrapolate and make some conjectures and make some recommendations on the best data that's out there. But those are some of the kinds of things, the thorny, knotty problems that the PACEUs get involved in.
Thank you. And I can definitely, we can speak from firsthand. We think the world of the PACEUs, definitely, as you mentioned, could use a lot more support and funding. We're appreciative that they've been around as long as they have, and for your personal history in their creation. And I know you've been very much connected and personally, connected for a long time. And we thank you for that. For those of you that are just learning about the PACEUs for the first time, please just Google PEHSU. Is it net? PACEU.net, I think?
Yeah, it's PACEU.net, PEHSU.net.
Yep. Local toll-free numbers in your region, websites, lots of helpful resources, fact sheets, sometimes can even help at times with some educational partnerships in the local area. So please do reach out if they can be useful. I find them incredibly useful, and we try to lift up their incredible work to the extent that we can. So thanks for that overview. Now, climate change, I know you also very much care about climate and its connections to vulnerable populations like children. And I know you've also been very involved in Clinicians for Climate Action. Could you speak also a little bit about the organizing of those units?
Sure. Let me back it up a little bit. So I had the opportunity to be on the Executive Committee of the American Academy of Pediatrics Council on Environmental Health, and then chaired that committee at a time when the Academy's policy on climate change needed to be rewritten. The Academy, as best I know, as best anybody knows, was the very first medical society to have a policy statement on climate change, and that was in 2007. So when I was chair, it was time to redo that. The data on climate change and the impact of climate change on human health, and the impact on climate change on the health of kids had grown tremendously. And so I was able to recruit Susan Pacheco and Samantha Adut to work on the policy statement and technical report. We got that out along with a whole lot of other policy statements and technical reports over the years. But when I rotated off, one of my goals was to make that a living document and to make sure it wasn't something that just sat on the shelf. And so at that point in my career, I said, I'm going to devote sort of the rest of my professional life to the issue of climate change and health and kids' health. The Medical Society Consortium was the brainchild of Mona Sarfati, a family physician and advocate who I had known since my Robert Wood Johnson Health Policy days. And then she was on the faculty at GW at the same time that I was. And then she went to Philadelphia before to Drexel, no, which medical school was she? Anyway, one of the medical schools in Philadelphia before coming back here to DC and starting to work on creating the Medical Society Consortium. So the consortium is a national organization. It's an organization of organizations. We do have individual members, but it was originally conceived as being an organization of organizations, American College of Physicians, American College of Obstetricians and Gynecologists, American Academy of Pediatrics, American Academy of Family Physicians, and on and on and on, thankfully. About 30 some odd medical societies right now, and about 40, almost 50 affiliate organizations, including the network and a number of others that work with the Medical Society Consortium. So the consortium focuses on federal legislation, and I've worked as a consultant both on a volunteer and paid basis with the consortium pretty much since Mona was trying to get it started. And one of the things that Mona, Mark Mitchell, who's the leader of the state activities for the consortium that I help him with, Mark is a occupational environmental health physician, public health physician, and a true expert on environmental health and environmental justice. There was a recognition that obviously with the previous administration at the federal level, not a lot was going to get done related to climate change over the last 4 years, thankfully now over. And also there are aspects of climate change adaptation and mitigation that, given the Constitution and all sorts of other ways that we have structured our country over the years, can only get done at the state level. So, for example, most states have a utility monopoly of one sort or another. We found out some of the problems that a utility monopoly can have in Texas recently. But if you want to have a renewable portfolio standard for utilities, you can't do that at the federal level. That's a state function. And so you can only do that by advocating at the state level. And there are a whole range of other things. In Virginia here, we're working on some transportation related legislation. So trying to increase the sales of zero emission vehicles in the Commonwealth of Virginia. And again, that's not something that the federal government has control over. That's something that state governments they don't control it, but they have some levers to pull to have some influence. So the notion was to create state level organizations that would advocate on climate and health topics in those individual states. So in Ohio, Aparna Bowl and others had created Ohio Clinicians for Climate Action. And that was really before the consortium got heavily involved. And that has been a model for other states. So I was involved in the rollout of Virginia Clinicians for Climate Action, starting with a very small group of physicians, nurses, physical therapists, pharmacists. So the state CCAs, the state organizations, are organizations of individuals. They're not organizations of groups. And we really work very hard to make sure that they are they span as many of the health professions as we possibly can. So in Virginia, we've built out an organization of over 400 people throughout the state. We do educational programming on a state level, and we do advocacy. Last year, we were very fortunate to be in a situation for the first time in Virginia in over 20 years, where the governor was a Democrat, the House of Delegates was a majority Democrat, and the Senate was majority Democrat. And we were able to, in conjunction with obviously a lot of other groups and a lot of individuals, get some very important climate change legislation passed, the Virginia Clean Economy Act being the primary one, which sets the the standards for getting to net zero carbon, et cetera, et cetera. And as I said, this year we're working on transportation legislation, and then working with the consortium between Mark Mitchell and myself, we've built out a network of about 15 groups, most of which are called, they're state named and then Clinicians for Climate Action. So there's Ohio, there's Virginia, there's Florida, there's Georgia. I've been involved in particularly Georgia and South Carolina. The South Carolina goes by South Carolina Health Professionals for Climate Action. So there's some variation on the theme. And there are also groups like in Utah and California that have formed totally independently of the consortium. And but we try and get everybody together for calls on an every other month basis, so people can share successes, share failures, look to their colleagues to figure out, how did you get that to work, and what can I do in my state, and things along those lines. And so it's been wonderful to see that, as I said, grow to 15 states that have been organized by the consortium, and probably another half a dozen states where people have self-organized. And then in parallel to that, Lori Byron, working with the climate change program at the American Academy of Pediatrics that I started, has developed a network of pediatric advocates in every single state and territory. So there's 1 or 2 pediatricians identified in each state who are climate advocates. We also get them together every other month, I think, for similar kinds of phone calls. Many of those pediatricians have become leaders in creating the CCAs. So the pediatrician advocate in South Carolina is Haley Gulke, and she's one of the leaders in the creation of the CCA in South Carolina. Gredia Huerta, whom you know very well, is the advocate from the Puerto Rico chapter of the American Academy of Pediatrics. And she, along with a friend of hers who's an ophthalmologist, have started the Puerto Rico CCA. So these are intertwined networks, not so much intentionally, but again, when good people get together, they by joining groups, they can multiply their effect. I've said that already a couple of times, but it's just so important, and it's been so rewarding to see these various networks begin to evolve and talk about climate from the standpoint of health. I don't want to say take the discussion away from polar bears, etc. But let's face it, if people around the world pay much more attention to their health, their kids' health, their family members' health than they pay to almost anything. And they understand their family's health and their kids' health and their parents' health much more than they understand glaciers and seas getting bigger because they expand when they're warmer and all that sort of stuff. So it's a means of talking to people in a language that they can identify with to make changes that will benefit the globe and benefit human health at the same time. So we get a win-win out of it.
No, it's fantastic. I think it's a very important model, and one that I know we've talked about because, having these extensions of folks that actually care, are passionate, and also have a background in at least understanding the vulnerabilities of children to everyone, but specifically the most vulnerable in our populations, I think is just an incredible set of resources and asset for all of us. And I only hope that we can magnify that and continue to build that for sure. With the Biden and Harris administration, I think a lot of us are hopeful that there are some new opportunities that we haven't had even close to having in the last 4 years or so. There's a lot to do, and we have this huge, public health crisis still upon us with the COVID pandemic. What might be your suggestions for how some of us in the children's environmental health field might consider strategizing and prioritizing the many needs that have always been there, and many that have been only further exemplified with a huge light shine on them during this pandemic in this last year? But what might be your suggestions for where we might put our energies, potential future funding, our strategy focus?
I think the human health focus remains an important and a good focus. I think that we need to work to get people who understand human health on John Kerry's staff. We need to get people who understand human health on Gina McCarthy's staff. Clearly, there are people in the EPA who understand human health, but over the last 4 years, the EPA has lost a tremendous amount of dedicated, knowledgeable staff people. And so we need to support Mr. Reagan as he presumably will work as hard as he can, and we all need to work as hard as we can to rebuild that agency and make sure that they onboard people who understand the human health impacts related to climate change. Specifically, as it relates to kids, obviously, there is an Office of Children's Health Protection in the Office of the Administrator. That Office of Children's Health Protection has been there for 25 years or so now. Who I'm presuming that Mr. Reagan, I'm presuming we need to work to make sure that he keeps the Office of Children's Health Protection in the Office of the Administrator. Who he might choose to lead that office, I don't know, but hopefully it will be a person who understands kids' health as well as environmental issues, because I think that office can be a major office in shaping things that come out of EPA, both as it relates to climate and as it relates to other topics like toxics. we need to work on getting carbon dioxide production down. That's got to be absolutely and positively the major singular focus. We've got to get away from these statements that, well, in the future we'll do this, but there's no teeth to them, there's no guarantee. We need to very quickly move into a system where there are goals, where there are consequences for not meeting goals, without getting CO2 production down, and probably also figuring out ways of getting CO2 sequestered. But without getting CO2 production down, people are going to die, and we've got to look at it from that standpoint. We see it dramatically in the number and ferocity of hurricanes, not only hitting the southern part of the United States, but also in the Pacific Ocean. They call them cyclones there, but it's the same meteorological phenomenon. And with things like tornadoes and this, crazy situation where it's, -3 degrees Fahrenheit in, Austin, Texas, and there's snow and there's no electricity and the water is contaminated because there's no electricity, and on and on and on. And if we don't recognize the fact that those kinds of storms and those kinds of extreme weather events cause people to die, if we don't recognize that our food supply is around the world is at extreme risk from changes that are occurring. One of the things that people who try and deflect attention from climate change say sometimes is, oh, CO2, it's great, it's food for the plants. Well, that's true, but when you grow plants at higher CO2 levels, the nutrient part of the plant isn't the part that grows. And the plants, like some ragweed and other things that make pollen that people are allergic to, make more of the pollen, and they make it for longer times of the year. And so people have more asthma attacks and allergy symptoms, and those asthma attacks occur at different parts of the year than what people are used to. So there are all sorts of things that need our attention. The air pollutants, that some of which we've talked about for years with the Clean Air Act as appropriate, are what are produced when fossil fuels are burned. And so it's not only CO2 that's impacting on human health. The CO2, at least at levels we today, and that we understand the way the human body works, we don't know that it directly adversely affects the human body, but we certainly know that particulate matter, oxides of sulfur, oxides of nitrogen, do adversely impact the human body. And so you can't disentangle discussions of climate change from discussions of these other pollutants. I mean, people want to call, reducing NOx and SOx and particulates a co-benefit, and then discount it because it's a co-benefit. Well, when you burn stuff, you make these things. And yes, these things they're not greenhouse gases in their own right, but they certainly harm human health in their own right. And so even if we didn't worry about greenhouse gases, we'd worry about these things. So let's get off this, trying to slice and dice these pollutants, they're all bad for human beings that may be bad in different ways, but we need to get them out of the atmosphere. We need to stop producing them. I think maybe I'm channeling Joe Biden here a little bit, but uh, that's what I think. We need to do this in a just and equitable way. We know that every environmental situation that we talk about that impacts human beings here in the US and around the world is a justice discussion from the get-go. Individuals who have lower resources, who are Black, Indigenous, or other minority groups in this country and around the world are all more severely impacted than our majority populations in the countries where they live. So here in the US, it's white populations, and in Europe, it's white populations. And we need to figure out how to get these pollutants out of the air and do it in a way that communities that have been adversely impacted are no longer adversely impacted, that the people whose health has been most impacted are protected going forward, and that people who have to change their lifestyle because they can't mine coal anymore, or they can't work in a coal-fired power plant anymore, that those people are, taken care of in a just and equitable way by people who are benefiting from the changes that they are required to make in their lifestyle.
All very well said. Definitely second everything. Thank you. Very important sense of priority, because you're right. There's a lot of, I won't call it infighting, but there's a lot of dissension at times among a lot of us on this side of health and conservation and well-being, that we need to be singing much more, I believe, also with one accord. I think we'll get a lot more progress done. And without a doubt, it's undisputable. The CO2 levels must come down in order to get to many of these other co-benefits as well, right? An agricultural system and the like. So thank you for taking some time to lay that out. As we're kind of rounding out here, the final question I have is thinking about, I know you've also, you teach and you advise a lot of students. This has been a role you've done over the years. There's a lot of folks out there that we talk to who are coming up kind of behind us, who are very energized and excited about what they're seeing and see nothing but opportunity to extend their skill sets and their passions. And then there's some other students that we talk to and that we do lectures in front of who are very disgruntled, right? And they're wondering kind of where they're going to fit in this nexus of, in their, as they're seeing a very divided country, a very divided, especially when we talk about not necessarily climate. We know most Americans do believe it's happening and very much is connected to human activity. And yet our actions don't speak those realities, right? And along with other things, I mean, there shouldn't even have to be a Children's Environmental Health Network that's going to be almost 30 years old next year, right? We shouldn't even have to still be around. I know Joy Carlson never thought we'd have to still be around 3 decades. And yet more than ever, I believe that, we still need to be at a lot of these tables because we constantly still have to be reminding folks about the vulnerabilities of children. So with all that said, what advice might you have for students as they're coming in to these sets of fields and they're trying to figure out where to best find their niche and their passion and to stay focused and not get too distracted?
I think, as I said before, find a group of people who share your values, who you want to work with, join them, and in the best sense of the word, then use them as a multiplier for your own efforts. This is an insurmountable problem when somebody looks at it and has the notion that they have to solve the whole thing. None of us can can do that. And none of us should have to do that. But we do need to work to make the world a better place. We all have our own small role. We all have our own small contribution that we can make. And if we get up every day and go out there and say, I'm going to join with these other people, whether it's a group of people in a laboratory, whether it's a group of people in an organization that is a science organization, whether it's a group of people, even though I'm a physician, I mean, certainly I know a lot of my physician friends over the years who may not have, gotten involved with something like the Children's Environmental Health Network or the Pesos or whatever. They may have gotten involved with civil society organizations like the Sierra Club, and they take their physician expertise or their, if they're a science person, a basic science person, they take that expertise to the civil society organization and make their contribution that way. So there are a myriad of ways to do it. There are a myriad of groups out there. You don't have to necessarily have a lifelong commitment to a group. Sometimes the group changes in a direction that's not your direction and you move on and do something different. Sometimes you change in a different direction and you move on and do something different. If you had talked to me even when you and I met at the Children's Environmental Health Network in 2000 and said, Jerry, what about climate change? I don't think either one of us would have had the vocabulary to talk for more than 3 minutes about, climate change. And, now either one of us can talk ad nauseum about climate change. So the world changes, or priorities change or whatever. And you move on and you do different things and you find a different niche. But again, I just think it's finding people that you can work with. So I do a lot of talking to young folks, and I'm forever trying to say, okay, who can I connect you with? Who can I send you to, who you can learn something from, who you can maybe collaborate with? Maybe it's a 15-minute conversation and that's all. Maybe it's the beginning of a long mentorship, whatever. But since I know so many people in sort of the system of children's environmental health, the ecosystem of children's environmental health, I can help people, make connections. And it's just a wonderful, wonderful sort of feeling to be able to elevate those who are coming behind. People elevated me. I may not have been able to thank them properly at the time. I may not have recognized what they were doing for me at the time. I may have been too dumb. But, I thank them by helping people like people helped me. And again, it's all about how do you make the world a better place, one step at a time. Nothing I can do, I can't make it perfect, but I can make it better. And that's my mantra.
Well, and I can speak personally, and I know all of us here at CEHN can speak personally to your personal, passion, dedication. There's a lot of things, as you mentioned in the beginning of your journey, a lot of different ways your path could have gone, right? And I would also encourage anyone listening, especially folks just trying to kind of figure out and navigate how you want your professional career to go and how you want to make change, in this world. And please don't pigeonhole yourself, take those opportunities, take those Zoom calls or hopefully future visits with people, listen, learn, absorb, because, I think both of our stories have a lot of our stories out here, but definitely ours. You didn't necessarily know that this was going to be the field of work that we were going to be so passionate about and feel so connected to. And Jerry, you continue to be a rock for us. I mean, you show up and you continue to show up, and we're also grateful for that. And it's an honor to work together to try to, as you said, make this world a better place each and every day. So thank you for your time today, and really look forward to, causing some more good change, good trouble, I guess, as John Lewis would say, right?
Right. Thanks, Nse. I wish we could have done this in person. I always enjoy my time with you, and I never have enough time with you. I'm glad to have this virtual time
Yes.
with you, and look forward to in a new and different world when we can literally work side by side as we have done so often in the past. So thanks for this opportunity. Congratulations on your anniversary that these interviews celebrate. I think it's a marvelous way to celebrate your achievements and over the years, and the way that you have led the Children's Environmental Health Network and the Children's Environmental Health field with such strength for the last 20 some odd years. So thank you, congratulations, and I look forward to another 100 and some odd years together.
Thank you, Jerry. I look forward to that. Thank you so much.